Yeah, today, Cynthia, we heard from the Minister of Health. She told CityNews point blank that there is a plan that they are working on to accelerate the vaccine for children who are 12 and up, as well as teachers. They want to get their second jab in arms before the September start to the school year in the fall. Though with a 4-month delay currently between the first and second dose, the clock is ticking.
By virtue of time, then the second dose would be needed before September as well.
Students are scheduled to return to school the second week of September. Currently, a 4-month wait has been set between the first and second dose of the vaccine. All students, teachers, and faculty would need to receive their first jab this week to get their second dose in time for the first week of school. That doesn't even factor in the 2-week period needed for antibodies to kick in for optimal protection. Though Minister Elliott is adamant, a plan is in the works.
Fortunately, with the increased supply of vaccines that we're receiving, both Moderna and Pfizer, we wish to start that as soon as possible. So we are actively working through that right now.
While vulnerable adults and hotspots are the priority at this time, physicians are quick to point out the important role children play in the vaccine rollout plan.
There's an increasing recognition that children can get it from the community. They spread it to each other in schools, they spread it to teachers, and then kids get it in school and bring it back to homes. And I've seen this in increasing amounts more recently.
Even with the province's pledge, the absence of any details on how to fully vaccinate students aged 12 and up, along with all faculty, has left teachers' unions skeptical.
If this government doesn't do something very quickly, we're going to have a problem. Now that you know that that vaccine is available, it's approved, actually have a comprehensive plan for both education workers, essential workers, and now children within that age bracket.
Pediatrician Dr. Anna Banerjee, who's also been leading the charge inside vaccine centres in Toronto, believes that even with school buildings currently shuttered, they could be essential to getting teachers, staff, and students vaccinated in a timely manner.
School-based clinics are probably the most efficient way to do it. You know which kids go to which school. You start in the hot zones. You get the kids lined up and you vaccinate them.
As we look elsewhere in the country today, Newfoundland and Labrador announced that they have a plan in place to get first shots into the arms of students before the end of this school year in the end of June, with a plan to be getting students fully vaccinated before the September start to the school year.